A stroke. It could happen in a flash. One moment, life is totally normal, and the next, the brain is under attack. Today, we're going to dive into those first critical moments of an acute stroke, which is a true medical emergency where every single second counts.
And the impact is just staggering. You know, stroke is a leading cause of both death and long-term disability around the world. But the really scary part, it's the speed. It just happens, out of the blue. And that's exactly why knowing what to do isn't just important, it's literally life-saving.
Okay, so if you remember only one thing from all of this, please make it this: the F.A.S.T acronym. It's such a simple but powerful way for anyone to spot a stroke. F is for face. Is one side of the face drooping? A is for arms. Can the person lift both arms or does one drift down? S is for speech. Is it slurred or strange? And T? T is the most important part of all. It's time to call 911 immediately. Don't wait. Don't try to sleep it off. Just make the call. So what is a stroke, really? Well, the easiest way to think of it is as a brain attack. It happens when the blood supply to part of the brain gets cut off, and that part of the brain is starved of oxygen. When that happens, brain cells start to die. And that's what causes those sudden, devastating symptoms. This brings us to the absolute heart of the matter when it comes to treating a stroke. It is, without a doubt, a race against time. There's a saying in the medical world, time is brain. And for good reason. For every single minute that a stroke goes untreated, the average patient loses almost 2 million brain cells. And look, this isn't just a catchy phrase, it's a hard medical fact. The entire evaluation is built around speed, because the most effective brain-saving treatments, they're only an option within a very, very narrow window. We're talking just a few hours from when the symptoms first appear. This timeline really puts it into perspective, doesn't it? From the second the symptoms start, that clock is ticking. The first 4.5 hours, that's the golden window for giving powerful clot-busting drugs. After that, for some patients, there might be other options, like physically pulling the clot out. But the options start to get more limited with every passing minute. The second a potential stroke patient comes through the emergency room doors, it is a whirlwind of organized chaos. First, the absolute basics: airway, breathing, circulation. Then, they ask what might be the single most important question: when was this person last seen completely normal? That answer sets the entire timeline for treatment. And at the exact same time, blood is being drawn to make sure it's not something else, like really low blood sugar, which can actually look a lot like a stroke. So, with that clock ticking away, the medical team has to solve one central mystery, and fast, because the answer is going to determine everything that happens next. Are they dealing with a clog in the system, or is it a leak? And I can't overstate this. Everything hinges on this one question. Think about it. If you give a powerful clot-busting drug to someone who actually has a bleed in their brain, well, that would be absolutely catastrophic. So they have to know for sure. How do they do it? Now, statistically, the vast majority of strokes, about 85%, are ischemic. That means they're caused by a blockage. The other 15% are hemorrhagic, which is a bleed. But you can't treat a patient based on a probability, right? You need certainty. Let's think of it like plumbing. It's a perfect analogy. An ischemic stroke is like a clog in a pipe. It's blocking the flow. A hemorrhagic stroke is like a pipe that's burst. It's leaking everywhere, causing damage. In both cases, the brain's not getting the blood it needs, but the cause and the fix are polar opposites. So the tool that cracks this case is a non-contrast CT scan of the head. It's a very fast type of imaging that is absolutely brilliant at one thing: spotting blood. If the scan shows bright white, that's blood. It's a hemorrhagic stroke. If it's clear of blood, it's almost certainly a clog, an ischemic stroke. And that one picture tells the doctors exactly which path to take. Okay, so the diagnosis is in. It's a clog or it's a leak. The next phase kicks off immediately, doing everything humanly possible to stop the brain damage in its tracks and save as much function as they can. So let's talk about that big 85%, the strokes caused by a blockage. For these patients, the goal is crystal clear: get that artery open and restore blood flow to the starving part of the brain, and do it yesterday. And there are two main weapons in the arsenal for this. First, you've got thrombolysis. This is an IV medication, a clot buster, that goes through the whole body to dissolve the blockage. The second is an incredible procedure called a thrombectomy, where a specialist literally threads a tiny catheter through your arteries all the way to the brain to physically grab the clot and pull it out. So does this stuff actually work? Well, just look at the data. This chart shows out of every 1,000 patients, how many are alive and living independently a few months later. Without treatment, it's 231. But with a clot-busting drug given within 3 hours, that number jumps to 329. That's almost 100 more people who get to reclaim their lives. It's just a powerful reminder of why speed is everything. Now, for that other 15%, the bleed, the playbook is totally different. The goal here is to stop the bleeding. That means getting blood pressure way down, immediately reversing any blood thinners the person might be on, and in some serious cases, it might even mean emergency neurosurgery to relieve the pressure building up in the brain. Just surviving those first few hours of a stroke is a massive victory, but it's really only the beginning of a new, often challenging journey. So let's look at what happens next, the first steps on that long road to recovery.
You know, all the data shows that where a patient recovers makes a huge difference. People who are cared for in a dedicated stroke unit just do better. And this isn't just a special room, it's a whole coordinated system. It's a team of experts, nurses, therapists, doctors, all working together to prevent complications like pneumonia or blood clots and to get rehabilitation started as early as possible.
And that proactive care goes way beyond just leaving the hospital. Preventing a second stroke is a huge priority, and this number is exactly why. Up to a third of people who have a TIA, or a mini stroke, will go on to have a major life-altering stroke. A TIA is basically a massive warning shot, a sign that something is wrong and you need to get things like blood pressure and cholesterol under control right now. The science we have today for treating stroke is just incredible. I mean, from drugs that can dissolve clots to procedures that can pull them right out, it's amazing. But here's the thing. None of that science, none of that technology matters if the person having the stroke doesn't get to the hospital in time. It all starts with one person recognizing those F.A.S.T signs and making the call. So the real question is, will you be ready?